suppose nobody listened to this after all of this? Then nobody's going to honestly listen to it. Oh, thank you, Jenna. Thank you, guys. Y'all probably do that. Really. I don't even know why I want to listen to it. But then I think it is. Is that the way it's supposed to look? Okay.
So this is chapter 14.
So this is chapter 14. So what I'd like to say now that the recording's going, Jared, thank you, is that on Wednesday we will have a lecture quiz, and let's go back to that beginning of chapter 12 where we talked about non-specific immunity and some examples of non-specific immunity, and then we also talked about in chapter 13 specific immunity. And with specific immunity, what two types of specific immunity that we also call adaptive, right? Immunity. What was another thing we called non-specific, by the way? Innate, right? Innate. Things we're just born with that protects us. And we had all kinds of examples. We had the complement proteins, didn't we? We had inflammation. What are the 4 signs of inflammation? Yeah, those 4 signs. Look them up. And then we had also, what else? We had so many things, right? Hair, skin, mucous membranes, fever, a type of non-specific innate. But in specific, this is just a quick little recap. In specific, I don't know where the time went. I apologize. Specific, we had humoral and we had cell-mediated, right? And we have specific cells associated with humoral where antibodies are made. What were those specific cells? B lymphocytes that become active and turn into plasma cells that pump out antibodies. Everybody did that? All right. And then in the cell-mediated, what type of cells? CD8 cells that are going to become, they're just going to do cell-to-cell combat, didn't we say? And the beauty of specific immunity is that once you have specific immunity, you'll have memory T cells and memory B cells. And so that's really the wonderful thing, because you don't have to keep getting things over and over and over again. Is that correct? All right, so that was a quick and dirty review of chapters 12 and 13. Would you say, Jenna?
I said B lymphocytes turn into what?
They turn into plasma cells that once they're activated, they turn into plasma cells that pump out antibodies.
Oh, you want to the recording to say the what is it? The case study.
Okay, thank you. So, guys, let me remind y'all of a couple things. So next, not this Wednesday, we're going to have a quiz on this, what we're covering, 12, 13, and what we covered today. But then we'll also on a week from Wednesday, I will not be here because I'll be in a conference.
So the 10th? Yeah.
Yes. So the 10th, I will be at a conference. Now, I want you all to know that the week after that, I need you all signing up for those little presentations. So the week after that's like the 15th and the 17th.
Yeah.
And then the week after that's a couple of days. I want you all to get those presentations done in those days. You know, maybe 3 or 4 people could go each day.
Keep talking.
Right? And so the actual date is the 15th and the 17th. You can figure out, know by Wednesday what dates you want, and we'll just go ahead and get those put in, the 15th and the 17th. Or you could do the 22nd, and would that be the 22nd and the 24th? Yeah, so and then we would still have, if anybody, you know, just didn't get theirs in, we would still have maybe that last day. That would be the very last day of class. And so whatever, I would like for you to get them done in those 4 dates, okay? Remember, there's a rubric. Try to follow the rubric. For those presentations. And is that fair enough? We'll do them kind of after class, after a little lecture, sort of during lab time, okay? There's very little bit left in lab that I actually can afford for y'all to do in lab. We've got some more microscopy to do, looking at parasites. But other than that, so that y'all's presentations are for those last couple of weeks during lab time. Any other questions? Wait a minute. Yeah, right here, Randy.
Has the exam schedule came out yet?
It'll just, no. Okay. But don't worry. It'll just, the last day of class, I think, is the 29th. And so what you all could plan is that's
week after.
Yeah, it's just the 29th is actually a Monday. So you could plan the Wednesday. Yes, the Wednesday. Does everybody know what the exam is?
The first.
What's the exam?
All of
It's the charts. And will every question be from the chart?
Yes.
It'll either be asking you which group is that organism in, or in that group, which ones may cause so-and-so, or you know what I'm saying? So it's just, if you know that really well, you'll be fine. Yes,
Are
Abby?
you going to go over the rest of the microorganisms that haven't been talked about?
Yes, because that's really what this last part is. As soon as I get through the day, we actually get to start talking about the organ systems, and we'll be adding to that list, and we'll be talking about ones on that list. Okay? Yep. Did I get every question? Okay.
We really just spent 23 minutes trying to give them.
So here we go. So when you think about immunology, immunology is really the study of this immune system and response, and you're really looking at hyper responses or overreactions, and then also under reactions, right? So when we think about the immune system now, we kind of know there's the innate, non-specific, and specific adaptive, whichever you want to call those two, and we know both of those terms. And we know what should be happening, but then we realize that part of our our infectious disease process, we said one whole category of how infectious diseases hurt us is through this overreaction. So in immunology, we have to study that overreaction or that hypersensitivity, if you will. So we're going to take a look at it when it's too powerful, when it's having the potential to injure. There are two sites, I think I mentioned it to you, maybe not, but there are two sites in the body where you're actually, it's called immune privilege, where this is actually limited. What sites are they? Your eyes and your central nervous system. Yes, absolutely. Your eyes and your central nervous system. Uveitis is actually, I don't know if you all, I just was reading something about this, which is kind of weird if I think about talking about it now. Uveitis, y'all can look this up, the inflammation of the uvea, which is the central part of the eye. It is an hyper reaction in the eye from the immune system, and it can be really serious, and it can actually be a cause of blindness. So we really kind of don't want the immune system responding, but it's a catch-22, because it also means whenever you have infection in those areas, can the body really do its job? So it's a real catch-22. But let's go ahead and look at this immune response, and when we see abnormal reactions actually happening. They're classified, and I don't think, have I told them? Okay, so they're classified in, not in here. So they're in 4 different types: type 1, type 2, type 3, type 4. And this is actually what they're called, these different types. So what I would want you to know about them, I think this is the best little chart, a table, if you will, for you guys to kind of know what they are in case you had to match, just in case, hint, okay? So type 1 is hypersensitivity, and it's IgE antibody mediated. Now, in case I didn't, and I don't think I did give you the classes of antibodies. I know in A&P you've had those, but I have a couple people who haven't had this yet in A&P too. The classes of antibodies there are 5 different classes, which are just related to how they look, their organic structure, and also how they're produced. But the classes are IgE, which is related to eosinophils and histamines, IgE. So these are going to be responding in cases of allergies and parasites. There's IgG and IgM classes of antibodies. IgM is the first class that's made when you've never been exposed to a foreign antigen before, and you get exposed to it. This will be the class of antibodies that are going to be the first ones that are going to start to be made. If the memory B cells get activated, if you ever encounter it again, it's hard to see this.
Yeah,
here.
it's really.
It's really. Well, the table is also little. Okay, let me do this since I like this. It's still hard to look. I think this board is just really hard to see from the side too. But anyway, so IgG is the second class. So the memory B cells are making IgG. So these are going to be antibodies that complement, that are actually the antibody reactions are going to cause the trouble. And then immune complex mediated. This is when the antibodies actually start depositing into the tissues of the body. And this is going to end up causing problems in these tissues. So these last three all involve autoimmune diseases, which you all know what that means. It means the immune system is attacking your own cells, right? So in this particular case, like systemic lupus, how many of y'all have heard of lupus and rheumatoid arthritis? Y'all have seen people with rheumatoid arthritis and lupus, and you know, their joints are swollen, their tissue damage is happening, and it can be systemic where this is happening, right? And then type 4 is T-cell mediated. So this is sometimes referred to as delayed hypersensitivity, where the type 1 is immediate, and type 4 is delayed hypersensitivity. And these are reactions that are going to be just slightly delayed, like contact dermatitis. Does anybody in here have contact dermatitis to something? Do you mind me asking what you're allergic to, Brittany?
A lot of expensive lotions that I can't use.
Expensive lotions? Is that what you said?
Scented.
Oh, scented.
Yeah, I have to use unscented everything.
So your skin is just delicate, yeah, and so you have to really be careful. And actually, we should probably all be with that. And how about you, Janet?
Yeah, some elastics, like a waistband, what calls it, maybe rubber.
Yeah,
I'm not
so
sure.
like latex.
I don't have latex.
You don't have the latex, well, that's.
I'm
Yeah.
allergic to my gloves at work.
I had a student last semester who is having serious reactions. Her hands, it was just like, a fine pen could have drawn the line where the glove was. Her hands got double the size, and the skin was completely cracked and whatever. They still haven't recovered, and it's been several months, and her hands still are not back to normal. So these reactions, you might be thinking, oh, delayed hypersensitivity, contact dermatitis, no big deal, that'll just, resolve. But they can be very, very severe, can't they? So these are the 4 different types of hypersensitivities that we see. Yes?
Does angioedema also include in this?
Angioedema, where the vessels are painful and swollen and whatnot, there's some things that can actually lead to that, but it's not the only thing.
I had that. My lips would swell and they wouldn't go down for like 2 days. And I went to an allergist that told me that they didn't know what I was allergic to.
Well, allergists, I feel it's sort of like I feel about dermatologists. I feel sorry for them because most of them, if you look at the numbers, and y'all can look this up, don't hold me to the number, but the last I looked up, it's about 80% of that allergic hypersensitivity reactions that patients exhibit never get known sources of what was causing it. But here's the good news. The good news is that typically people will go into remission from it and might not after a while ever have the reactions again. So like systemic reactions, like especially if you're near your airways, are you worried? Like your lips, your throat, your nose, anywhere in your face, you would be worried about swollen areas because they can block your airways. But a lot of them, they never figure out like what it really was that set you off. Yeah.
When I was a kid, I was allergic to like everything. Like I couldn't eat any fruits, and I was like definitely allergic to like cats and stuff. And like the fruit allergies, I guess I grew out of the kind of like allergic. But how do you like grow out like that?
I don't really know if they say you really do grow out of true allergies. If you had true allergies, you had you had all the testing done. Yeah, and so I think what some people have reactions to, especially like fruits and things like that, might not be to the fruits themselves or the vegetables themselves. It can sometimes be preservatives, and so they can have reactions to those types of things. It's the same reason that some people have reactions to immunizations, the vaccines. It's sometimes the preservatives that are in those immunizations, the stabilizers that are in there. Again, I was just reading a thing about somebody saying that their doctor had told them not to get the flu shot because of the, oh my God, is it Thermosol? So it is. It's a metal, and it's a mercury-based metal. And that is true. When you read it, it says that. And their doctor, who'd been their doctor for 40 years, had said not to get it. It's no reason to get it, and it's because of whatever. But with a little education to that doctor, who'd been a doctor for decades, that is not absorbable in the body and clears the body. And the amount that's in the vaccine is so low that it has considered no negative thing, except for sometimes a local kind of reaction that can happen that usually resolves. So I don't know if you said they did testing. It's like you don't outgrow cat allergies. I have a son who thinks he's going to outgrow a dog hair allergy. It's not all. The thing is, if you're allergic to cats, you're allergic to every cat because their allergen is stable. So even between your there's no such thing as domesticated. These young cats are not considered domesticated; they're considered feral. But even from the cats to the lynx to the tigers, they all have the same allergens. So if you're allergic to one, you're allergic, not that you don't want a pet lion. But okay, nobody wants a pet lion. But dogs are different. Dogs have different allergens. And so it is possible to maybe be allergic to certain types of dogs, not others, right? So that whatever, but
What about hairless cats?
And hypoallergenic
yeah, but there's actually that's actually a myth. There's no such true thing as hypo. What did you call it?
Hypoallergenic.
The dogs. There's really no. They call them that because there's less people that react to them, but some people still do.
But they don't really shed as much.
They don't shed as much, and so the reaction might not be as much. And I don't know how it goes. Is there some reason you want one? That was Harold.
No, I want a hairless cat.
I was just kidding. Okay, call me out on the prejudice. Okay, so call me out on it. You're calling me out on it. Am I being called out on it, Abby? I'm being called out on that, right? Call me out. It's okay. We're going to start doing it. All right, so guys, make sure you kind of know these categories, and I think it's not a bad thing to do. To touch on that immediate allergy thing, where I said that poor allergists, they're having to tell people, well, I'm not exactly sure what you're reacting to, but here's some treatments, some antihistamines. Histamines are the #1 most rapid group of allergens that cause all these responses that you think of as being allergic responses. That is the largest group. So what people tend to do are take antihistamines, right? Is it possible for people when they have this to have very serious immediate reactions that, bees, shellfish, so we talked about, and then they're going to have to maybe, if that's the case, blocking airways, you're talking about EpiPens. Do I have somebody with him? Okay.
I'm sorry, what's anaphylaxis?
Anaphylaxis is like shock, going into shock. And people should know that shock means that you have dangerously low blood pressure. Your blood pressure is dropping quickly, and it can definitely be affecting your airway too. Type 2 is going to be that IgG, IgM, where you're thinking about like blood group incompatibilities. Did we say those can be deadly? So people who are in medical professions need to understand that you have to be careful about cross reactions and blood typing and that sort of thing. But these are going to be these antibody with direct antigens causing problems there. In type 3, it's going to be the antibodies being made that are laying down in the basement membranes of the tissues, causing inflammatory responses of the tissues. And all of these can be very, very serious, right? So autoimmune diseases in these last 3. And then type 4 is when we're talking about like graft rejections and those types of things, contact-delayed reactions and contact dermatitis. So just some basics about that, okay? An allergen is really just anything that can elicit that kind of allergic response. So when you think about that, atopic types of things are local reactions. So most people think of hay fever as being that way. Does everybody understand that asthma is a hypersensitivity reaction? Asthma is reactive airway disease to these allergens. And everybody is a little bit different about what might cause their asthmatic events and attacks. But asthma is reactive airway disease to known allergen, to allergens that are going to cause that. And anaphylaxis, we said, is systemic, so it's happening all throughout the body, and your blood pressure is dropping. You may be losing airways. Some allergies last a lifetime. Some, they said, are outgrown. It is now, the theory is out there that probably you don't truly outgrow necessarily, but you can seroconvert. If instead of producing IgE, we say immediate type 1 is immediate allergies, and it's IgE category of antibodies. IgE is what's causing all of those reactions that you have and all those symptoms that you have. But if you could convert to IgM and then IgG, then you wouldn't have that. So that's the whole theory behind getting allergy shots. They're trying to expose you to very serally diluted, where you each time get a little bit more of what's causing you your allergen, until you start making IgE and you start making IgG, and then supposedly outgrow them, if you will. So that's the whole idea about that. But a lot of times they really don't think you can do that. I know some of you probably had some good outcomes from shots. Have you? Allergy shots? Okay, nobody in here. All right. The hygiene hypothesis we talked about. Can you be in too clean of a world? Are you supposed to be exposed to these foreign antigens early enough that your immune system, sort of training your immune system? So we had talked about that. Yeah, so make plenty of mud pies, right? Effects of breastfeeding and just how important it is that if possible to breastfeed, no woman should be shamed into breastfeeding. Some women don't produce enough milk to sustain the neonate. So if that's the case, that's fine, that's fine. But if a woman can, and whatever, this would be a great thing to do. If we know that it greatly reduces the risk of asthma and eczema. Eczema, y'all know, are skin, superficial kind of skin reactions to allergens. Everybody know what eczema looks like, don't you? Yeah. That causes pruritus, which is a lot of itching. So has anybody had hives in here other than just the swelling was a hive? So it's supposedly really itching. So, right.
I used to get my grass after soccer.
Yeah, and so do you now get that or not?
Oh, I still get really bad hives sometimes.
Okay. Pactins are going to be these little substances that actually are tiny, but they end up joining with other substances that may be in the human. And what is going to end up happening here is then you have this delayed reaction. You can develop these. So anybody who thinks that they're not allergic to poison ivy or poison oak or any of those things, and that you're not allergic, so you're going to go retrieve that basketball or football that flew into the woods, be careful, because you can develop those.
If you don't want to know,
So it's a delayed allergy, basically.
So it's like just for this particular class, because it is something that you can actually develop. So, so what did somebody say?
I have to use a delayed allergy.
So it actually, causes that delayed reaction. Those are those delayed reactions because they're the small molecules that on their own, they can't do anything. But if they join with the molecules with other molecules, then they can cause a reaction. So what else was I going to tell you about that?
I used to play in the woods all the time, but I've never got poison ivy years.
Yeah, but sometimes it really doesn't matter. Like if you did before, you might put then later, right? So anyway, I don't think we're done this. So you can guys look at if any of y'all allergic to dust mites or pollen. Yeah, some of you are, and Molly, you said you were allergic to everything, but maybe you've kind of outgrown some things now.
Like I can remember like my face was on my eyes.
Yeah. Which is kind of sad. Because some of them, the ones with hair, are really cute. Okay. But so you can kind of see what some of these immediate reactions are. Some of them actually can be anaphylactic in their reactions. Histamine being that most fast-acting one. So we can take histamines, can't we? We can take those. And these are just some of the other molecules that can cause some of those symptoms. Are these molecules normal to have? And do they actually have really good? I mean, we need them, but we don't need them in excess, in huge amounts. Because you can just see what their functions are, how in excess amounts this would not end up being a very good thing to have these. So, all right, so there's a lot of different ones.
You're trying to move so fast.
I know, but I think it's because we've had, I mean, most of us, I'm not going to ask you anything I didn't say out loud.
I feel like you're rushing because you have to leave.
I probably am talking about it rushing, but I actually kind of want to get through this because I feel like most people have had it. have seen this. Drug allergies, can they be serious? Yeah, this is really, really scary to me, these drug allergies, because I think sometimes when people are asking patients, have they ever had any allergic reactions? You know, some patients might not really know what drug it was that caused a reaction before. And here's what I need you all to know about drug reactions. The first time you have a reaction may be really serious. The first time might be serious. But what do we know about the subsequent times? They're going to get worse and worse. And that's a very serious thing, because they may not be in your office or in your ER or close by medical personnel when they have these reactions, right? And if they don't get someplace quickly, is that going to be a life-threatening event? Yes, and yes, Molly.
When I was younger, I got stung by 2 red ones at the same time, and it was like this little pill thing, and it had like purple liquid in it. It had like cotton on the end of it, and I popped the pill and like dabbed like the liquid on like the sting spots. Like, you know what that could be?
No, I have no idea what that could have been. I had the same thing happen to me when I was lifting tobacco sticks up in the barn, and my daddy spit his chewing tobacco on me. So maybe it was something to do with chewing tobacco. No, I'm only lying when I say that. But that's exactly what he did. Yeah, I did. So, but I don't know. That could have been a lot of different things. I have no idea what that medication would be. Would any of my medical people know that have been what that might have been?
Like something like, you know, you break it and have a little. She said it was in purple.
Yeah, it was. I think it was probably something just to maybe like a little local take the sting. Did it take the sting out? Yeah. So, but I don't know. And I was joking about I wasn't joking about the nicotine. He really did spit on me. But I it's okay.
Yeah, I had bees stinging in my lip, and I'm really allergic to bees too. But like before they had to get the stinger out, and my mom just broke her cigarette and just slapped the tobacco on my lip.
Those were back in the days. Okay, when nobody should have been chewing or smoking. All right, look. So guys, have y'all had these kind of skin tests done? Is this what you had, Molly? Did you have the skin things?
I did.
So and you did too? Okay, so so this is what they're looking for, these reactions. That anybody else had these? Has anybody seen these? Did they do this on this looks like an arm, but they're doing them on the back now. Did y'all do them on the back?
Yeah.
Yeah.
You do it like on your shoulders.
Yeah. So, all right. So really treatment and prevention. The real prevention is avoiding the allergen, you know, so that's what y'all are good with this. So you try to avoid the allergen. If you get exposed to the allergen, then you're going to have to treat the reaction. And treating these hypersensitivities is actually by suppressing the immune response. So that's going to be the way that you're going to really have to do that. And we said antihistamines are pretty mild, you know. So taking antihistamines, they're even across the counter, aren't they?
Yeah.
So they're over the counter, and that's not too big a thing. Theophylline is like a serious thing, so that's prescribed. And then epinephrine and EpiPens, these are prescribed too. But people who have serious allergies that can cause serious reactions should have up-to-date EpiPens that they keep with them all the time. And I think we've talked about that, haven't we? Yes.
All right, so there was this case, like criminal case, where this mom, everyone's probably heard of it. The mom was lying to the doctor saying her daughter was allergic to a bunch of stuff, and she'd give her the EpiPen in front of people. Wouldn't that like kill her? She wasn't actually.
Yeah, EpiPen is a serious medication, so it's going to be vasoconstricting, right? It's going to vasoconstrict, and it's going to cause a heart rate to go up and heart contraction. So it's a serious medication. Should not be really given unless there's going to be a medical personnel on site within minutes of that. So even if you have to give it, like we were about to give it the other day, well, it was a month ago, to one of the governor's school students, and I said, you know, I was trying to make the evaluation whether she should get the EpiPen. I said, we'll call the rescue squad first because we want them here within minutes before we would give an EpiPen because they need to take her somewhere.
I mean, the girl actually like lived through it, but
yeah. So that no, it's definitely a serious thing. So type those are the immediate reactions. Type 1. Type 2, we said it's going to be like ABO blood typing or Rh factor. Now, Rh factor was that idea that the D antigen, and I know, again, some people haven't had maybe about ABO blood typing, but this is why you want to cross-match people perfectly, right? And you also want to make sure that a mother has not made antibodies against the D as in dog, antigen, because if the mother has and the baby is Rh positive or D positive, those antibodies can cross the placenta and cause problems. And so this is why Rh negative women get Rogan, the shots, at 20 weeks and within 72 hours of delivery. Rh factor negative, D antigen negative women will get the shot of Rogan that will prevent her from making, if she got exposed to the D antigen, will prevent her from making antibodies against the D antigen. Because if she makes antibodies against the D antigen and ever gets pregnant with a fetus that has the D antigen, her antibodies will destroy the blood, will attack the blood of the fetus. So this is sort of telling you that, and this is a type of type 2, response where you don't want this happening. That could potentially cause hemolytic disease of the newborn. The name for that is erythroblastosis fetalis. So people should know that this is the type 2 hypersensitivity type of reaction that can happen. And luckily, it hasn't happened in about 60 years because in modern medicine, people get prenatal care. This is, again, a reason people want to get prenatal. You hear about how bad the world is. It's a lot better than it was 60 years ago because, this is just another one of the things that makes the world better nowadays, right? Women don't have to worry about this anymore. Before they did. Okay. So this kind of talks about how this can happen. All right, type 3, this is when you're going to think about these antibodies laying down in basement membrane, the tissues of our organs. So entire organs are going to be affected by this. Organ systems are. So we talked about like this type 3 as being also a very serious thing with lupus and some other autoimmune diseases that we think about. Now, I don't care about the Arthus reaction, but that is an obvious reaction, right? The delayed, we said, was type 4. Do you remember? So the delayed is the type 4, and it's because of T cells. So that's a T cell thing. Graft reactions are also a type of T cell reaction. So when somebody gets a graft, if it's an autograft, what does that mean? Yeah, so it's from yourself. So it's from somewhere on your body that you put in. And should you react to that? No, because it was yourself. So, but if you get a graft from from a donor or whatnot, then this could actually be the host rejecting the graft. So when the host is rejecting the graft, and all of this type 4 is because of T cell activity, delayed. When the host is rejecting the graft, that's bad enough. But how would you treat that? Well, you try to suppress the immune response, but if it's too late for that, what are you going to have to do? Remove the graft. But what happens when somebody gets like stem cells from bone marrow? Then what is it? Then the graft is attacking the host, right? And this obviously is going to be a much more serious type of thing. And when this actually happens. So there's 2 different types of graft incompatibilities. Now, the host attacking the graft, but then cells in the graft attacking the host can also be one. So they have to figure out which type is actually happening before they figure out what to do. These grafts, auto, we said self. Iso means you have an identical twin. How often do we have identical twins? Rarely. Most people don't have identical twins. Allo means that it's between individuals, but within the same species. And xeno means that it's from different species. So, we've gotten like pig valves, right? Y'all have heard of people getting pig valves and other types of things. Well, that's a major one I've heard of. So, what'd you say?
What's the one like,
So this is a little picture that can help you with that.
put it somewhere in your body?
What did you just say?
Like you can take some, like your ear and put it somewhere in your body and it'll have like growth.
It'll help to grow tissues and stuff.
What is that called?
Yeah, but still, if it's your own stuff, if it's your own cells, then you're not having to worry about a cross reaction.
Right.
But any other thing that's not auto, then you're having to be aware and be concerned of rejection, and what kind of rejection it is. It's going to end up being. But you know, this is making the immune system sound bad. Is the immune system bad? No, the immune system's wonderful. So look, these are some of the autoimmune diseases. Y'all take just a look at that. I'm not going to be so picky that I'm going to want you to know what type of hypersensitivity, you know, whether it's 2, 3, or whatever. But I just think take a look at this just so you kind of understand about these autoimmune diseases and what is happening in these autoimmune diseases. Because we've certainly talked about them, haven't we? All right, and so then we understand that as far as mimicry, we've got this idea that some autoimmune diseases, you end up having something very mild, like a little virus that never caused you to even know you were sick, but you ended up making antibodies that cross-reacted with your own cells because they look so much like it. Y'all have all heard of psoriasis, haven't you? Is psoriasis just limited to the skin? No, it can be more systemic too. It can be in joints as well. So there's psoriatic arthritis. Y'all have heard of? Has everybody seen psoriasis on the skin? This is like eczema on steroids, right? It's hard and silvery and scaly and white and thick and cracked and bleeding, and it's a lot of them. So whatever you think of eczema is looking, because I've seen some pretty serious eczema too, but it is nothing like psoriasis. That is a serious.
Isn't it mostly like on your elbows?
Y'all can. It can be in areas that are. It can be in the scalp. Yeah. It can be like on the buttocks. I've seen most on like elbows. Yeah, but it can actually be any throughout, even on areas that you would think wouldn't be irritated or bending or any of that. It can actually be in those. And y'all know the butterfly rash of lupus. Have y'all heard of that? The butterfly rash of lupus, and then certainly this is ankylosing arthritis, isn't it? Rheumatoid arthritis, where you see the swollen joints that are obviously painful and no longer having much movement, are they?
The end of my grandma's fingers or something like that.
Are they? Hmm. That's awful. Okay, so we know Graves' disease, type 1 diabetes. These are all types of autoimmune diseases. When y'all hear these names, you should kind of know that's autoimmune. HIV, is that an autoimmune disease? You are not leaving my A&P or my micro classes thinking that HIV is an autoimmune disease, is it? No. It's a what? It's a virus that's an infectious disease, a communicable disease, a contagious disease. It is not an autoimmune disease. People who have autoimmune diseases, are they contagious for other people? No. Y'all get this. It's a very, very different situation happening. Multiple sclerosis. Y'all can see some of the theories here, right? So this is another autoimmune disease. Now, immunodeficiencies, and I am going to just cover this because this is going to be finished, because I'm really excited, because after this, we actually get to start organ systems where we really concentrate on our charts. So that's another reason I was talking fast, and I'm going to be late for Dr. Johnson. Not that he cares about me. He doesn't know me. Okay. I might not really have to know him for very long. It's 3 of them, by the way. Might not be. Okay, this is recording. Don't anybody share. Okay, I'm just saying. All right, look, guys, when we talk about primary immunodeficiencies, these are things you were born with. They're things that you were born with. Okay, I know you probably won't know all this. I'm saying that. So maybe you're lacking complement proteins. Maybe you're lacking the ability to make certain classes of antibodies. Maybe you're lacking a thymus gland. So primary immunodeficiencies are congenital. These are things that you are usually born with, meaning that you have genetic errors that are leading to these. Then there's secondary immunodeficiencies that are acquired afterwards, like HIV, right? That would be a secondary, wouldn't it? So look at these categories. This is actually showing you some. So secondary immune deficiencies, AIDS, cancers, you are immunocompromised. Stress, are we more at risk for infections if we're stressed? because cortisol's turned on. We've got higher levels of cortisol, which is the immune system's taking a back seat, right? The adrenal glands are pumping out, but that's the immune system taking a back seat. Maybe because of removal of your spleen. Maybe you're taking steroids because, I don't know, you're doing whatever.
Good nutrition.
Absolutely. People who are in famine areas, or people who for whatever reason are not getting the nutrients they need, that is a good one to bring up, because that's probably, Jared, the most common, people just not having the nutrients that they need. And you guys, I think that was some of these are very specific, but I think that was really going to kind of be all. Okay, let me see if it's so anyway, are we good?
Yeah.
If I find something on here I didn't do, I'll do for that. Do y'all have enough to do a study guide for the whole? Because we haven't been doing study. Have you done study guide? So look, we'll do, and this is really just about immunity. So non-specific, specific, and then some problems of immunology, hypo and hyper, right?
So study guide for 12, 13, and 14.
Yeah, maybe just do a good study guide. And I know some of you do such great study guides. So use each other.